Good day, Professor Cohen. My name is Shirrell Monsanto, and today I'll be talking to you about penis plantus, also known as fallen arches or flat feet. To give you some background information, pes planus, also known as flat feet, is a postural deformity, which means structure. The arches of the foot collapses. The entire sole of the foot comes into a complete or near complete contact with the ground. It have an estimated that 20 to 30% of people today have flat feet because the arch simply never develops in one or both feet. Here is a picture of an infant feet. As you can see, no arch is present. This is because the arch does not develop until early childhood. What makes the arch so important? The arch provides an elastic, springy connection between the forefoot and the hind foot. The association between the two acts as a safety net or guard for the forces that occur during everyday wear and tear on the foot and the hip. This is a diagram picture of an adult foot, both with a flat arch and a normal arch. But we're going to focus on the picture with the flat arch. The adult with the flat foot, the head of the talus bone is displaced medially and distal from the navicular bone. In adult flat feet, the spring ligament and tendon of the tibialis posterior muscle stretches to a point where the penis planus loses the function of the medial longitudinal arch, also known as MLA. In adults, if the MLA is absent or non-functional in a both seated and standing position, it is called a rigid flat foot. However, if the MLA is present and functional while sitting or standing up on their toes, but disappears when standing upright, is known as supple flat foot. This is an illustration of two adult feet. With figure A, you can see that the entire sole of the foot has collapsed to the ground, whereas with figure B, you can see the entire sole has not collapsed to the ground, but no arch is present. In figure A, you can see a displacement with the talus bone and the tibia bone as it's more curved versus figure B, which is more longitudinal, straight. For some, flat feet develop later on in life, later in adulthood. This is because or due to injury, illness, prolonged stress on the foot, and normal aging. Adult acquired flat foot is mostly seen in women ages 40 and older. This is because these women suffer with obesity, hypertension, and diabetes. For some, flat feet can also be seen in pregnant women as a result of the temporary changes that the body goes through during elasticity during pregnancy. Also to note, an important factor is that if flat feet is acquired in adulthood, most likely it will remain permanent during the course of life. The diagnosis of flat feet can be done by a medical professional. They would simply have the patient stand on their toes. If the arches form while they're on their toes, it's called a flexible flat foot. While on their toes, if the arch does not form, it's called a rigid flat foot. In some instances, patients may be experiencing pain and discomfort. They will then order them MRI, a CT scan, or x-rays on their foot. A test that can be done at home is called the wet foot test. What would happen is that the person would put their foot in water. They would then stand on a smooth, level surface, for example, a cardboard or a sidewalk, and they would see the more the sole of the foot makes contact with the ground, it would leave a footprint. The more of a footprint they see, the flatter the foot is. In closing, Flat feet are astomatic, which means they rarely cause any pain. For individuals suffering with flat feet, it's okay. Just wear supportive shoes and monitor your feet on a regular basis. Thank you for listening, and I hope you enjoy.